Oh, some 20 minutes after 8. It's a Thursday. Our healthy men's conversation is what is up next right here on the show. And today we're opening the phone lines so you men can, talk to my guest. He's a clinical psychologist and also a lecturer. Asafo Seth Mawusi is our guest on this conversation. He's a lecturer at the Accra College of Medicine. Good morning to you.
Good morning.
It's good to see you. Thank you for coming through.
You're welcome.
So, we've started this month of June. We kind of dedicated our Thursdays to men, and we've been discussing a lot of men's issue. Last week we touched on the sexual health disorders. Where we didn't quite go was how to get help and what is help really. But with your experience, I want us to start the conversation this way. Why don't you tell us some of the things that men usually either report or that's something worrying men, but they hardly talk about it?
Okay. So I'll start by saying that for something considered a sexual disorder, it must cause significant distress to the person in question, whether man or woman, in this regard. So in most cases, there are a lot of things that we might consider as a disorder which aren't actually disorders because it doesn't cause any significant bother to the person in question. Okay. Now, I think the most primary sexual problem that most men have and have reported is that those that have to do with erectile dysfunction and then premature ejaculation. Okay. Which are the basis. And for these, you have a lot of pharmacological treatments for, especially with erectile dysfunction. And that's where the issue of aphrodisiacs come in. Yeah. The most common ones are that we know about, which are approved by the FDA, is the Viagra, the Cialis, Levitra, and these ones are pretty much safe to take. But on the other hand, our local brews, nobody knows what kind of concoctions these are, and they believe in alcohol and how it affects a man's sexual prowess, which in fact, we have evidence to prove otherwise.
Yeah?
Yeah, alcohol actually makes you more feminine.
So, it does?
Exactly. Alcohol releases more estrogens in a man. So if you take alcohol, you might probably be doing more harm to yourself than good in terms of the sexual performance. Okay. And alcohol
but my understanding is a little bit of it, maybe the wines kind of tickles you a bit, that kind of thing.
So it disinhibits you. So in that case, you're likely to feel more pleasure in that essence. Okay. But to add on to your sexual performance, particularly, no. But what most people don't realize is, when you take any alcoholic bottle, there's a label of something 40 VOL. Yeah. That shows that what is in that bottle that makes you get drunk or feel woozy is alcohol. And in medical terms, we call that ethanol. That in no way can improve your sexual prowess. However, the other 60% is made up of different substances. So those substances could actually make you perform in that regard, and not because it's alcohol. So you're better off just using water and those herbs, or coconut water and the herbs. Like that's what it is. Okay. Yeah.
But at least there's some help, because like you said, there are some medicines that you can use.
Exactly. Okay. Exactly. Now, it's not all sexual disorders that are medical per se. Some of them are psychological. Majority of the psychological has to do with women, but for men, the most significant one is what we call performance anxiety. So what happens is a man has a certain fear of not being able to perform adequately, and as a result of that, they start to develop or shy away from the activity. And before long, they develop what you call the low desire for sex. And then we can actually diagnose them with what we call a hypoactive sexual desire disorder. Okay. Now, the low desire for sex can be caused by a myriad of reasons. Sometimes it's because of another condition. And in that you have dyspareunia, which is pain during sex. And as a result of the pain, they just don't want to.
A man could also experience that?
Of course.
That's something that
you hear women say. No, of course.
You hear a man say that?
Of course. In some cases, they get bruised, and for in extreme circumstances of people who have performance anxiety, their go-to thing would be to buy some aphrodisiac. And in most cases, these aphrodisiacs are not prescribed by the right medical practitioners, or they're more like referrals from friends. Oh, I heard about. And then they go and buy something, and they have an erection for 6 hours, which is a medical emergency.
That's abnormal.
Yeah, I mean, in that case, they are destroying all the, and we call that priapism, which is a medical emergency. Because of that anxiety, they want to outdo. So, I mean, anything anyone says, quickly they go and buy it. To men out there, please be careful.
Yeah.
Or else you might actually lose it. And that's the truth.
So, we hear a lot of, I can't get myself up, that kind of thing. How long should you be up for, really? Essentially,
you mean as in to have an erection?
Yes.
Well, there's no specific timeline for how long you should be up, because usually once you start the process of foreplay prior to sexual activity, as a man, a normal functioning man, you should have an erection.
Okay.
And so this erection should be sustained enough to be able to complete an activity of sex. So, and that's where the issue of premature ejaculation comes in, which is another problem that some men experience. So they are not able to hold the erections long enough to complete one entire cycle of sex. So for some, I mean, before even the woman comes, it's already done. And that is something that we normally work with. And so the issue of delay sprays come in. But essentially, these things are considered more psychological. That is if we're able to rule out any medical aspects of it.
Okay.
Yes.
So when you say psychological, I have a very simple way of putting it. It's in your head. Is
Perfectly.
That it?
Perfectly. So it's in your head. Like the belief that I cannot will almost make you not be able to.
Okay.
That's the truth. And the belief that I can also make you to. Now there's a technique that we use, we call Sense8 Focusing. Okay? And it starts off by helping people to feel a sense of desire, even when they are being touched. And so we've noticed that for most people, before they lose their desire for sex, sex becomes more of a mechanical thing. It's programmed. You have a specific time, Friday, myself and my wife, and after that, it's done. If as a man you don't fantasize about your partner, that is a big problem, and that might be an indication of a low sex drive. If you're constantly waiting for let this be done and let me just be done with it, it's another thing. If you're doing it solely for the purpose of satisfying your partner, that in itself might be an indication of a low sexual desire issue. Exactly. Yeah.
All right, you can send us a message. We're going to put the number on the screen in a bit. You can send us a WhatsApp message. Also use that same number to send us a regular text message. And then in just a little while, you can just give us a call, 0302-211-69-102. And let's close this conversation up. Is it so difficult to find somebody to speak to as a man when you have these personal
problems? It is. Very much. And you see, in our part of the world where masculinity is tied to sexual performance, it's a big deal. And so, apart from the fact that you're with very close friends who constantly discuss issues about sex, and even that, it's difficult for any man to accept that I'm underperforming. Men give themselves labels like I'm a dragon, I'm a stallion, and the last time I was with my wife, she was all over the place, and that's the impression they give. But in some cases, that's not it. I mean, I had one client like that who described a very perfect or utopian sexual life they had. And the wife thought otherwise, and I wondered.
But is that what the man truly believed?
I think he was just being a man about it. So it was difficult for him to open up in the beginning. Eventually, he did, and then we found other ways to help him out. But it's a very difficult thing for a man.
So men like to be manly even when they really have...
It's Ghana. And it's Africa. It's Ghana and it's Africa. And that's why aphrodisiacs are gaining so much popularity. And I mean, both legal and illegal ones. People are making a whole lot of money out of these things. Yeah.
All right. So give us a call now, 0302-211-69-102. Okay. I seem to have a little issue with my WhatsApp, but just keep sending the messages. I'm sure the messages will download in a bit. 0302-211-69-102. My guest is Mr. Asafo Seth Mawusi. He's a clinical psychologist and also a lecturer. Okay, so here's a message that says, oh, please, I'm not asking you to call the number, or I'm asking you to call these numbers, 0302-211-69-102. As for the number you see on your screen, it's for WhatsApp messaging and regular SMS text messaging as well. This one says, I do masturbation secretly before having sex with my wife to prolong the sexual satisfaction. Is it advisable?
Well, in some cases, yes. But depending on your orientation, masturbation could have a very negative effect on you. So we found that among those who are very spiritual, when they masturbate, it's followed by a sense of guilt, which is really grandiose or so profound that it might actually affect the activity that follows. But generally, it's something that's advised for people who are not able to maintain their erections for too long, or people who have premature ejaculations.
But is this something you should be guilty of, when you do it?
From a professional point of view or from a social point of view, no. From a religious point of view, yes.
Okay. Somebody is asking, what are the consequences of masturbation on men, and how can one stop it?
Okay. So for masturbation, for starters, it is only considered a problem when it's excessive and when it impairs your other functioning. So if, for example, as a man, if I masturbate several times in a day, or I'm in the office and I have to excuse myself to the bathroom to go and masturbate, or I'm even with people or have a wife but I secretly go and masturbate, that's becoming more of a problem because it's excessive and it's interfering your life with other people. And some people masturbate to the point that it's difficult for them to form like healthy relationships with the opposite sex.
Okay.
Because they can take care of themselves anyway.
All right. Let's go to the phone lines. Kwejo is in Takwa. Eugene, I'll come to you after Kwejo. Good morning, Kwejo.
Good morning.
Thank you for your call. Let's hear you.
I just wanted to know about a small penis to have effect.
Kwejo, you have to speak up so we can hear you clearer than we do right now.
I wanted to know if small penis can also have effect on the sexual aspect.
If what can have effects?
If you have a small penis.
Okay. If it can have effects?
Can it have effect on sexual issues?
Okay. All right. Thank you very much, Kwejo. We're going to address that. And Eugene in Takoradi. Eugene, good morning. Hello, Eugene.
Hello.
Yeah, hi, Eugene. We can hear you. Please go ahead.
Mine has to do with a little misunderstanding I have. Hello?
Yes, we can hear you, Eugene. Please go on.
Okay. I seem to understand everything you are saying, but then does that low desire in sex has anything? Can a woman also get into that kind of situation, whereby it's more like, oh, let my husband finish up and let me go, or
can I answer that because I'm a woman? Yes, it's a yes.
So what brings about that? Let's say a situation of the female being let's say a green hawk as a virgin when married, and then and then in everything that the man does, let's say both of them were, but then the man had an orientation of it, but then the other doesn't. How does the guy or the married man get it? Because it will become frustrating.
Yeah.
Try to put your wife in the little moments of yours, and then it's not appreciated in any way.
Yeah.
So how do you get it done? Maybe out of that desire her low desire will even eventually make the man lose interest in even coming close.
So, Eugene, I kind of have a personal experience with what you're sharing. I would like to talk to you. So please just hold on. Give your number to my producer. She's going to take your number, and I'll call you right back. Even though we'll try and touch on it. Don't give up. Don't give up. Razak, we'll speak to Razak. Razak is in Tamale. Razak, good morning.
Good morning, madam.
Hello, Razak.
Hello, yeah, I'm on the line.
Okay, Razak, you sound very far from the phone.
Good morning, madam. Hello?
Yes, let's manage it. Hopefully, yeah. Please go ahead.
Hello? Okay. That probably has to do with two things. Premature ejaculation at the same time.
Razak?
Hello?
Yeah, Razak,
Okay, that probably has to do with premature ejaculation and at the same time, this causing erection.
Okay. All right. We get you. Thanks a lot. We're just going to hold on with the calls so that you can address. I think it was premature ejaculation he was trying to say.
Okay. I really didn't get Razak's own, but for the first one, he asked about whether small size penis could actually affect or cause a sexual disorder. Is that
if it can affect the act?
So it cannot cause a sexual disorder. It can affect the act, yes, but there are different ways in which to make it seem bigger, even with the size, depending on what positions you want to assume. But you should be careful. As a man, if you have a small size penis, there are certain sexual positions you cannot try.
Okay.
Because it will only give you out.
Okay.
So
can he have a private conversation with someone? I mean,
sure,
that's why I asked, where do you get help? Like, or even somebody to just talk to?
Yes. The Department of Psychiatry of the University of Ghana School of Medicine and Dentistry has a lot of people like that. I'll be there as well.
So you can just walk in any normal day and just say you want somebody to talk to?
Perfectly.
Wow.
Perfectly. So that's the first one.
Okay.
And the second one asked about if women can also experience a low sex.
And I quickly answered that. I said yes.
Which is very true. Now, I give you a lot of instances. Most women disengage from the act of sex or the pleasure because they find it a waste of their time or not fulfilling.
Oh, okay.
It gets so routine. Like my husband just comes in, he shows up, and that's how they say it.
Yeah.
He just shows up.
And he thinks I should be ready anytime he is.
Exactly. But for men and women, our ways of getting turned on or getting ready for the act is quite different.
Yeah.
Men can just start their engine. Women are more like diesel engines, so they'll kind of warm up with the time. So you need to have some time to prepare her for that. Yeah. Now that might be one of the reasons. Another reason will be the fact that there are a lot of social or there are problems between you two which are not resolved. And like we say, sex is best enjoyed when it's spontaneous, when there are no pre-imagined or like it's not something that's on the timetable. Monday, 12 o'clock. It's not that. And if you're not able to bring that spontaneity back, sometimes it might just take out the fun or the thrill out of it.
Yeah.
And so I hear a lot of people say that the best sex is the quickies at the most obscene or the weirdest places. And that's because it's more spontaneous. And the brain is not functioning at the time.
It's like an adventure.
Perfectly. Why does someone want to have sex in an elevator? You think about it. They're not thinking. So that's more disinhibited and it gets much better. But I think he'll need to talk more about it for us to be able to give a significant solution to this problem. But yes, women do.
I know stress can also cause women too. And sometimes the men don't take us out. It's so boring. Like everything is so boring. It's just so one way. Like when was the last time you took your wife out, like on a Friday night, just the two of you, and it's not any occasional, just casual outing, like just let's hang out. Those are some of the things that, listen, you don't even have to give us any other hints. We know naturally that things will follow from there.
You see, from my experience, it's funny. The men also think that all this outing is not necessary. We need to keep money to pay for this and to pay for that. And in the long run, we need ourselves only.
You don't have to go to any expensive place. You can just take a walk. You know? Just chocolate.
She says it so simply. I wish all women would.
Yao Elam is in Akosombo and he's joining us via phone. Yao, good morning.
Yeah, good morning.
Yeah, good morning. Are you Yao Elom or you are one of your Yao?
Yes, yes.
Okay.
Yao.
All right. Please, let's hear you.
Okay. I want to ask, what are the causes of masturbation, and what are the remedies that can be done to avoid it?
Okay. All right. Yeah. Thank you very much. So, do we have Elom then on the line? Okay. All right. So, masturbation is coming up, and I have some messages also on masturbation, and it's how do you stop it? Is there a way to?
So I think what he asked was how do you...
What causes it?
What causes masturbation? Yeah. Okay. Now, masturbation, like all addictions, okay, is something behavioral. It is learned. It is not per se like a gene or a pathogen or a virus whatsoever. It's
so this one is in your mind?
Yes, it's in your mind.
Okay.
It's something that is learned. And for humans, anything you find pleasurable, you're predisposed to do again and again and again. Now, there's a level of satisfaction you get when you start any behavior. With time, you need more of it to actually get the same satisfaction that you used to get. And so that's essentially how masturbation starts. Now, when people say they want to stop masturbation, the first question I ask them is, do you think it's a problem? Because if you don't see it as a problem, then it's useless.
But if you want to stop it, then I'm thinking that it's because you think there's something wrong with it.
Not in all the cases. Sometimes people want to stop masturbation because someone said, especially those that have to do with a religious connotation.
Or they probably had a conversation like we're having right now.
Yes.
And so they are reflecting back on something that they do and
like
they're thinking.
I had a client who went into a severe depression because he was masturbating and he heard a verse or a preacher say something about masturbation. And so the boy just tipped off into severe depression, like, it's bad, it's bad, it's bad. Now, my job there was to open his eyes to the fact that it's only bad if you think it's not good for your health or it's interfering with your social life. That's from the social point of view. Religiously, that passage that goes to say someone threw away semen, you know, there is a meaning behind it that we normally use for this treatment. But once you accept that you have the problem, we'll take you through the same addiction recovery program that we do for alcoholics, sex addicts, all of them. It's an addiction.
So first, you must come to the point as an individual
Perfectly.
that this is wrong. It's interfering with something.
Exactly.
And okay. So it must be your decision.
Yes, you need to accept it.
Okay.
That's it.
Okay. All right. Let's see if we can share. Hey, Charlie, people have called that the phone is dead. But there was also premature ejaculation. I wonder, is there a cause for that?
Okay, so for premature ejaculation, there is a biological cause. So for that, you need to see a urologist to do all the examinations and say, well, yours is medical, so they might prescribe medication or do a couple of procedures for you. Now, with the ones that have to do with the psychology aspect, is essentially because of the performance anxiety that I spoke about.
Okay.
So the fear that I may not perform as expected is enough to make you lose all your control. And so just before, it's a drop. And so it's our job to make you realize that it's not something that has to be. I mean, people have a very funny view of sexual activity, and I sort of blame what the world is putting out there about what sex is. So all these pornographic movies or movies about sexual activity lasting for 35 minutes, 1 hour, and all of those things, they are not real. Okay? These are all enhanced. So if a man buys into the idea that I have to have sex for an hour, that in itself is a lot of pressure on that person. So you can imagine, like right before that, all my mental faculties are sort of on, I need to be able to. So much so that the one that I get for control to do the act is not there.
Yeah.
So that could be another psychological aspect of premature ejaculation.
Okay. Yeah. Yes, somebody's asking how to cure oversensitivity at the tip of the penis, as it also causes premature ejaculation.
Yeah. So for oversensitivity, there are a number of delay sprays that are on the market. But before you do that, I suggest that you see a urologist first for them to give you a solid prescription. I mean, there are some that people talk about, you hear dragon and tiger, and you wonder why they give such fierce names anyway. So that reduces sensitivity at the tip of the penis, and so will extend the process of sex. But you need a formal assessment before you,
Okay, somebody says, I last for 5 minutes in the first round of sex. Is it normal?
Very normal. Very, very normal. 5 minutes, he's doing well.
Okay. This person says, I want to know whether withdrawal method can cause a woman to get pregnant. Hey, okay. To get pregnant. I mean, is it just me?
So he's talking about coitus interruptus.
Yeah, but that should not. So I wonder why.
I mean, sometimes it's a little sip.
Oh, maybe you did it too late.
You know,
a little too late.
Okay. Goes, so.
This one says he's masturbated for about 5 years now. I even did it yesterday night. How will this affect me? I think we come back to the same point. Do you think this is a problem?
Yes.
Do you think this is a problem? Okay. This one says, and I think that people are, okay, so my phone is going to come back to live again because some people try to call when we're having the conversation. But I'm seeing messages that are really personal, like people are talking about itching, the penis itching and things like that. Is it so difficult? Because I see that as for women and our gynaes, we can just get there and talk to them.
Yeah.
Who can a man talk to like that?
He can talk
and
to
why is it so difficult?
He can talk to his general practitioner. He can talk to a specialist like a urologist. He can talk to like a clinical psychologist or any essentially health care provider. But in most cases, men feel like they'll be judged by that. And I give you an example of a young man who had some level of herpes around his genital area, but wouldn't see a doctor because he said he had a small penis and was shy. They'd see the size of his penis. So you can imagine, this is, you need help and you need to go for it, but you won't.
But is that what you, clinical psychologists, doctors, urologists, is that the kind of thoughts that goes through your mind when you have a patient sit in front of you and open up, because at that point they're so vulnerable, they're telling you everything about them?
I mean, not at all. Especially from in our field, we hear so many things. I mean, that is just small, it's basic. People talk about more intimate and very sensitive things to us, and we actually create the environment for them to be able to open up and discuss all these things. And once you're able to push off that vibe of, I'm not being judgmental, you get a lot of people tell you all the things that are bothering them. So from us, yes, maybe sometimes in the medical setting, because of the loads of patients they see, they might not have that time to actually engage you so much so for you to be that comfortable to release all this information to them, because they're more mechanical. Yes, 1, 2, 3, next. So yes, but yes, you can get help. And you should get help. You should get help.
Okay. All right. Is there a second website? Is there a way that you can probably talk to someone without the person seeing your face?
Not in Ghana. Not in Ghana. We don't have that in Ghana. But I know for a fact that if you do send an email to the University of Ghana Medical School, Department of Psychiatry, you will get a response.
Okay.
Yes. So in that case, they don't know you, but they can provide a resource. The main idea will be to make you feel comfortable enough to come in, and not to do this.
Is it advisable to open up to your partner when you have these personal issues?
Absolutely.
No matter what.
Absolutely. So for sessions in sex therapy, the most important thing is communication. And in Ghana, it's frowned upon in a certain light, especially when women are discussing or telling their partners what they really want. It like a sense of a vibe as if she's a whore or she's a prostitute.
Or she's too experienced.
Exactly.
How come she knows so much?
So most women will not open up about sex, but it's important for you to open up if you want to keep your relationship. You want it to last, you need to open up about it and say, I like A, B, C, D. I dislike A, B, C, D, and what you think you're doing, it's not so much what I want.
Do men appreciate that? Because it's also about how is he going to take it?
I would. I can't speak for all men.
Yeah, but is there a tip that you can give as a psychologist? what do I have to know that my man is a certain type before I can go all out and say such things?
Well, that's for the marriage counselors. the certain times for the marriage counselors, they be able
but
to
I think all men should open up, because if you do it, it makes the women really comfortable.
Yes, but will all men open up is the question.
I think they should.
Will they?
I think they should.
Yeah, they should.
Fruit should. It's one of my cameramen. Christopher should. Fortunately, Christopher is married, and he should.
He is.
Okay, so in wrapping up this conversation, I don't know how you want to box it all together.
Okay, so like I'm saying, there are varying degrees of sexual disorders and dysfunctions. I didn't really touch on that because we have a group of disorders we call paraphilias, and these essentially have to do with extreme out of the box sexual perversions. So like for people who find they have the desire by showing themselves naked to other people.
Yeah.
Like exhibitionists, the voyeurs who rub themselves against other people.
I think last week there was also those who peep.
Yeah, that's the voyeurs.
Oh, okay.
And then the fruiteurs will rub themselves against people in like buses or lines. Yeah, and that's how they get there.
Crowded places.
Exactly. Then you have the sadists, the masochists, sexual sadists, sexual masochists, all those people, those who experience pleasure by pain, those who experience pleasure by receiving pain. You have all of those people. And then the transvestic people, they find pleasure in dressing in the opposite sex, or they feel like they are not who they're supposed to be. They feel they're supposed to be more male than female. So like all these things are there. Now, some years ago, homosexuality was considered a mental disorder, but now it's gone past that. Bestiality still considered a disorder among certain countries, but in other countries, it's pretty much very normal now. So we're saying that the experience of sex, although it's varied, is made up of different people and different things, and it's a continuum. The only time we consider it as a problem is if it impairs your function in any way or causes any significant distress for you. And that's what's important for us clinically.
Okay.
Exactly.
All right. I appreciate your time this morning, and I hope that a lot more men, will try and get some help. Thank you so much for your thoughts.
You're
Asafo Seth Mawusi is a clinical psychologist, and he's also a lecturer at the Accra College of Medicines. And he says, you can just go to Legon, the psychology department. Is that what you said?
Yes, you can go to University of Ghana. I mean, generally, if you go to any hospital, they will make a referral. So just go to your general practitioner.
Okay.
Yeah.
All right. And men, opening up a bit more. Somebody sent me a message. I was going to read and then it went off. You're disagreeing with me about the outing. Just take a walk. When was the last time you took a walk?
It's not
safe.
safe.
Last time you even...
It's not safe now.
Stay with us. Becky has entertainment. And by all means, we have to give the mood ahead of the Premature College at the Saddle and St. Thomas Aquinas, the finals of the National Science and Maths Quiz program. We'll bring that to you definitely before we wrap up. But here's Becky Ketsi Etel with some entertainment.